Hello, my name is Austin Harbo, and today I'll be going over my critical thinking assessment reflection. So the purpose of this reflection is to compare both my entrance and my exit ATI results, identify any strengths and areas of growth that I have, and connect critical thinking to practical nursing in the future. So to begin, my overall scores. So for the entrance exam, I got a 72.5%, and for the exit assessment, I got a 75%, showing an overall increase in my critical thinking skills throughout my nursing school. And here is a categorized breakdown. So for interpretation, I increased from a 33.3% to a 66.7%. For inference, I increased from a 66.7% to an 88.9%. For evaluation, I decreased from 100% to an 87.5%. For analysis, I say the same at 50%. For explanation, I decreased from an 85.7% to a 71.4%. And for self-regulation, I decreased from 100% to a 75%. So looking at that, there were some surprises in these results. Mainly, I had a lot of strong gains in interpretation and inference, which was awesome to see. I did feel really well with those areas throughout my nursing school, so it was good to have that reinforced. Although the two areas being explanation and self-regulation decreasing was a little bit surprising. I feel like I have been working a lot on those during nursing school, but obviously in a testing format, I have not been doing too well on those. So, to start out, this is what is critical thinking in nursing. Critical thinking is broken up into those five aspects that we just looked at with the critical thinking assessment being interpretation, analysis, evaluation, inference, and explanation. So first up is interpretation, which refers to understanding and making sense of patient data, such as vital signs, lab values, assessments, and patient statements. For example, recognizing the trend that a trend of decreasing blood pressure and increasing heart rate may indicate internal bleeding requires strong interpretation skills. My improvement in this area likely came from repeated exposure to patient scenarios in clinical situations and simulations, such as my clinical at the ARC, which is a acute rehab center, where we worked with a lot of patients right after surgery that could be dealing with these types of issues. Analysis involves organizing information, recognizing patterns, and prioritizing care. Nurses use analysis when deciding which patient needs immediate attention or which intervention should be performed first. Even though my analysis score did not improve, nursing school constantly challenged this skill through care plans, prioritization questions, and complex patient scenarios. This tells me that while I do have a baseline skill level, I do need to continue some real-world experience to strengthen this area. Inference and evaluation in nursing. So, inference refers to the ability to draw conclusions and anticipate potential complications. This is especially important when recognizing early signs of patient deterioration. My improvement in inference likely reflects increased clinical exposure, particularly in high acuity settings such as the PICU that I was in at HCMC, where anticipating these changes in these patients is incredibly important and can help find their condition if it's getting worse a lot sooner. And then we have evaluation, which refers to determining whether interventions are effective and whether the information is reliable and relevant. Nurses use evaluation when they're assessing pain after medication administration or determining whether a plan of care needs adjustment. Although my evaluation score slightly decreased, it remained relatively strong, likely due to frequent reflection during clinical post-conferences and simulation debriefings. Next up, we have explanation in nursing. Explanation involves clearly communicating clinical reasonings to providers, patients, and other nurses. This includes SBAR reports, handoffs, and patient education. While my explanation score decreased, nursing school required frequent verbal and written communication, which suggests that this skill continues to develop more strongly in practice than in testing situations. Overall, nursing school experiences such as simulations, clinical rotations, and NCLEX style questions, which were on the exams that we took, helped improve my interpretation and inference skills while highlighting analysis and self-regulation as areas that I need to work on more. And here's some strategies for growth in the future. The two areas I need to focus on most moving forward are analysis and self-regulation, as weaknesses in these areas can directly impact patient outcomes. Difficulty with analysis may affect my ability to prioritize care effectively, which could delay critical interventions. Challenges with self-regulation can impact decision-making under stress and limit my ability to reflect on and adjust my clinical judgment. During my first year of nursing practice, my main goal is to improve my prioritization skills and to reflectively think on things that have happened in my practice. To strengthen analysis, I plan to ask experienced nurses and preceptors to explain their thought process and when prioritizing care. I will review rationales for clinical decisions and practice breaking down complex patient situations into clear priorities during handoffs and shift reports. To improve on self-regulation, I will intentionally reflect on any challenging patient situations that come up through the use of informal debriefing with my coworkers. I will seek feedback on my clinical judgment and stress management, especially in high-pressure situations. I also plan to use evidence-based resources and to just slow down when making decisions to avoid cognitive overload. These strategies will help me build confidence and improve my critical thinking skills all at the same time. So, as a final reflection, one of the key lessons I did learn from this assessment process is that critical thinking develops gradually and requires continuous reflection and practice. Growth does not always occur evenly across all areas. Even strengths can fluctuate over time. Comparing my entrance and my exit assessment helped me recognize how clinical experience directly improved my interpretation and my inference skills. Strengthening my critical thinking abilities will benefit my future nursing practice by improving my confidence, my clinical judgment, and my ability to adapt to complex patient situations that I may be seeing in the future. By continuing to reflect, to seek some feedback, and to use evidence-based practice, I can provide safer, better, more effective, and much more patient-centered care. This reflection has helped me understand my growth and prepare for continued development. Thank you so much.